Speaker, Madam Vice Speaker, ladies and gentlemen, welcome and good afternoon. As you've already figured out, I have a little bit of laryngitis. I wanted to sound like some other person, but I'll do the best I can. One of the things that began under the leadership of Dr. Patty last year was the creation of a video to showcase the activities of the college. I've asked the Department of Communications, Publications, and Marketing to update that, and at this time I'd like to show you the latest version of the college.
The American College of Radiology is advancing the practice and science of medical imaging and radiation oncology to help ensure safe, high-quality patient care. ACR enhances quality and safety by accrediting more than 35,000 facilities nationwide and maintaining appropriateness criteria and practice guidelines to help physicians provide the latest in evidence-based care. The ACR Clinical Research Center conducts groundbreaking trials that advance the practice of medicine, set new standards of care, and ultimately save lives. The ACR supports healthcare economic research through the Neiman Health Policy Institute to help make medicine more efficient. And by educating lawmakers and the public, ACR champions important policies and initiatives that benefit Americans and the American healthcare system. ACR members enjoy career-long medical and professional learning. The ACR Commission for Women and Diversity works to make radiology reflect the nation we serve. And the American Institute of Radiologic Pathology, ACR Education Center, and ACR Radiology Leadership Institute make better providers and better leaders at every career stage. For nearly a century, the ACR has moved medicine forward and helped ensure that patients get the care they need from those most qualified to provide it. The American College of Radiology. Quality is our image.
Thank you. This videotape will be available for our members to be shown in their offices, waiting rooms, at state chapter meetings, and so forth. Just contact us and let us know if you'd like a copy. Now, it is my privilege to present to you the report of the chair to the council. I have a lot to say, but I'll try to do it relatively quickly, both for your benefit and for mine. In a bit, in some sense, this will overlap slightly with Dr. Fleischmann's and Dr. Neiman's remarks. What I'm showing you now are the initiatives that occurred since our last meeting in 2012. And I won't read these all, but you can see the major initiatives, including the launch of the RLI and the campaign, the creation of the Neiman Policy Institute, and a new commission on women and diversity. There have been ongoing activities in economics advocacy with RADPAC. We have our annual ACR Forum and our Inter-Society Summer Conference this year, featuring information, education, and networking. We continue to plan for 2015. Another new initiative is the creation of an ACR Institute for Head Injury. We have done several HR commission studies and look at the workplace, retirement, and other issues related to the practice of radiology. I would also like to commend Dr. Hillman and all the staff that works for the JACR and congratulate them on their 10-year anniversary. We've also founded a website for the American College of Radiology Foundation. And following this meeting of the annual AMCLC, there will be a 3-day international conference held here at the Hilton Hotel. We're calling it the Global Summit on Radiology Quality and Safety, and will include representatives from over 30 countries. It's sponsored by the European Society of Radiology, the International Society of Radiology, and the ACR. I want to take a moment to thank many people. I'm sure that I've left some people off, and time doesn't permit me to thank everyone. We have 400, a little more than 400 people that work for the college, but I want to I want to highlight a few people. I would like to thank all the members of the Board of Chancellors and the Steering Committee, all 400-plus members of the staff, and all of the member volunteers. We have over 1,400 physicians and physicists who donate their time to the college. Our executive committee is composed of the officers that you can see here, plus 2 members which I appointed, Dr. Blumberg and Dr. Brink. We have 29 members of the Board of Chancellors. I'm going to recognize just a few of these because of their special contributions this year in leadership, advocacy, and economics. Chancellors Cynthia Sherry, Bibb Allen, and Geraldine McGinty made particular headway in areas like the Radiology Leadership Institute, the Health Policy Institute, and Imaging 3.0. Under education, you already saw that we received ACCME commendation, and I'd like to congratulate Chancellor Sherry Cannon and thank the staff of the college as well. Dr. Cannon and her staff are also involved with the ARP, the Education Center, Case in Point, and many other products. Under quality and safety, I would like to point out that Chancellor Deborah Monticello and the people from the staff have been intimately involved with our work in decision support and a new product called ACR Select. As always, they work with guidelines and standards, one of the main important features of the annual meeting. In human resources, Chancellor Ed Bluth has been instrumental in performing the surveys that I mentioned a few moments ago. As far as ACR 2015, our new meeting, the planning committee in particular has been led by our Vice Speaker, Kimberly Applegate, and Chancellors Sherry Cannon and Deborah Monticello, who are leading the planning of the program. Once again, thank you to Dr. Chancellor Bruce Hillman for the JACR. A special recognition to Dr. James Brink, who has single-handedly represented the ACR along with staff to create this global summit on radiology quality and safety that I mentioned will take place at the end of this week. In particular, I owe a debt of gratitude to Chancellors Fleischon as Speaker and Kimberly Applegate as Vice Speaker. And I want to also thank Brad Short for the efforts of the American College of Radiology Education Days in Haiti. Here's a relatively short list that you may not be able to read from where you are, and I'm not going to read it all, but it highlights many of the Chief Financial Officer, the Chief Executive Officer, the Associate Executive Directors, Senior Directors, and many of the key people in the college that I have had the pleasure to work with this year. And these people are dedicated, talented, and I could not do what I do without any of them. I also need to recognize the spouses of all of the board members, the steering committee, our volunteers, and the staff. It's you people that stand behind our people to get this work done. Thank you all. I'm going to very briefly go through some of the initiatives that we've already mentioned. The Radiology Leadership now has a permanent home, at least a temporary permanent home, in the Education Center. You've seen this before. I believe we have 5 levels of productivity, beginning with residents and fellows, moving on to proficiency in leadership, advanced proficiency, and an MBA. We have a common body of knowledge that you already heard about. And these are the organizations that we have partnered with: Harvard Business School, Kellogg School of Business and Management at Northwestern, the AAPM, that's the Society for Physicists in Medicine, the RBMA, the Radiology Business Managers Association, and others. And we all get to see now that we have over 1,000 people, that have signed up and registered to be part of the RLI initiative. Our launch last year in July at the Kellogg School was a tremendous success. We were very fortunate and happy to have Jeff Immelt as our keynote speaker. This year we will repeat that event in July, and I'm also happy to announce that Senator Tom Daschle will be our speaker this year. The Harvey Neiman Policy Institute gives me special pleasure. Particularly happy that we could name this institute after Harvey, who has spent so much time in radiology, both as a practicing radiologist, a chair of a department, a member of our board, chair of multiple commissions, and then our CEO for the past 12 years. He has been very influential during those years in health policy, and we thought this would be most appropriate, and we were delighted that he agreed to allow us to use his name. The main point of the HPI is to prove radiology's cost effectiveness and show the value of radiology. The mission really is listed here, but again, I'm going to save you some time and my throat a little bit of discomfort. The college, I believe, does have the obligation to do for its members at times what members cannot do for themselves. The Harvey L. Neiman Health Policy Institute has been established so that members can act appropriately when asked to participate in non-traditional payment systems. The socioeconomic staff and physician volunteers will have the data needed to maximally effectively advocate on behalf of radiology, and the government relations and physician volunteers will have the data they need to be maximally effective on the behalf of radiology. We're very fortunate to have Rich Duzak as our Chief Executive Officer and Chief Medical Officer, and Dr. Danny Hughes as our Research Director. This is the Board of Directors. Bibb Allen is the Chairman of the Board, and you can see the names of a very distinguished group of radiologists that helps Dr. Allen run this along with other members that I mentioned. We have released several policy reports. The first one you can see was labeled the Neiman Report. It talked about the decrease in medical imaging and some of the side effects that may or may not be causally related. One thing that was found was that as hospital stay increases, imaging utilization decreases. Major accomplishments of the HPI in this first 7 or 8 months: launched quarterly policy brief. 5 peer-reviewed reports have been accepted for publication in various journals. We have awarded over 7 seed grants to academic researchers totaling $350,000 and developed a web-based tool to examine Medicare data. I brought this to the attention of the White House, and you can see that they agreed with me that this is a big deal. The Commission for Women and Diversity is also very important to me. We have 29 members of the Board of Chancellors. It is not very often that a new commission is created. In this particular case, the Association for Women in Radiology came to me and asked if there was a way that the Society for Women could have a closer relationship with the college. We looked at various mechanisms and ultimately decided that a commission would accomplish this. The Association for Women, which was established about 35 years ago, will remain independent and continue to do their programs and have their set of officers. But those people will also now, to a large extent, populate our commission on the Board of Chancellors. The Committee for Women will look at many activities, but in particular, one of the things that they will start to look at is how do we attract more women into radiology in terms of percentage and total numbers? Can we do research and find out how we can help women advance to get more women as chairmen of departments and more women as practice leaders, presidents of groups? Other issues that are important to women include pregnancy, maternity leave, and so on. And I leave it to the AAWR to tell us what other issues we need to evaluate. This commission, however, will not be strictly devoting its efforts to women, but we'll look at general diversity. We will look at multiple factors, including those that you see on the screen, in particular age, gender identity, geographic background, race, religion, sexual orientation, socioeconomic status. If you look at our Board of Chancellors, look at our steering committee, look at our council, our staff, and our profession, we are not particularly diverse at this time. I think we can be stronger and improve not only our profession but our society by working in this area. I'm happy to announce that 3 people have agreed to be the leaders of this entity. Dr. Kasia Matsura from Johns Hopkins will be the chairman of the commission and will be a member of our Board of Chancellors starting on Tuesday of this week. The Committee for General Diversity will be chaired by Johnson Lightfoot, who is a practicing radiologist in Pomona, California. And the chair of the Commission for Women will be Dr. Julia Fielding. She's an academic radiologist at the University of North Carolina. We've created a pin, a mosaic logo to represent diversity. I hope the counselors and alternate counselors, when they checked in at the registration desk, got that pin, and I hope you will wear that proudly. This is, again, a rare event that we have a new commission, and as you've probably heard, you only get one chance to make a first impression, and I'd like to make a very good first impression for the Commission for Women and Diversity at this meeting. I won't take a great deal of time. These are the members of the commissions and the chairs and their designees. ACR 2015 is moving along. I told you this last year, but I'll repeat. The idea here is to increase our communications, to bring the energy and enthusiasm and information that we get at this annual meeting and that we get in the board, bring that information back to our members. We want to engage our current members and try to secure additional members to join us. This facility that we're in, the Hilton Hotel, is not big enough. We'll be moving up the street in 2 years to the Marriott Wardman. The planning committee is far into the process of developing the meeting program. I don't intend for you to be able to read this diagram, but I want you to see that the program will be more diverse than we have now. In addition to all of the things that we know about the annual meeting, we'll be adding content from the AIRP, from the Education Center, from the Radiology Leadership Institute, from the JCR, and bringing that to the annual meeting along with some clinical content. We'll be working with the RBMA and with multiple smaller societies, some of which we manage. We'll be adding additional content in the form of a keynote speaker as well as our annual Morton lecture, and we will have vendors present as well. We hope that this will increase our presence on Capitol Hill. We think that as we take more people to the Hill, our voice will be louder and stronger, particularly if it's unified in our message. Imaging 3.0 is an initiative that was created by the Economics Commission and Committee, and largely was the brainchild of Dr. Bibb Allen, who is the vice chairman of our board. He will be talking more about this later in the week during our economics session. I've stolen a few of his slides. Just briefly, Imaging 3.0, we'll be looking at not only radiologists, but at referring physicians, the entire medical enterprise. It'll be looking at payers, policymakers, and it'll be looking at the patients. Each of these people have a role to play. Radiologists are not living in a vacuum, and we need to bring these people together. We'll also be looking at how to leverage information technology, how to refine our productivities and values, and how to establish relationships with our patients. Now, I suspect that some of you, particularly long-term members of the college, may feel that the wheels are coming off of radiology as we know it. I don't think that's the case. If you've been a reader of the ACR Bulletin and the JCR, you know that I recently wrote a column about half full. I have a generally optimistic outlook on life. I think there's a lot going on, but there's a lot more good that's happening in radiology than bad. And so I believe that the glass is half full. I want to take just a moment to delve into this a little bit further, to kind of give you a tease as to what we're going to be hearing later this week. There are a few facts that I think are irrefutable and most of us recognize. Reimbursement, it's going down. Job opportunities at the moment are less than they were a few years ago. Money for research and teaching is also decreased. Productivity is up. That's probably a good thing to a point. But job satisfaction is down. One other fact that you may not understand, but here's a report from 1 year ago from the advisory board, that although our compensation has decreased, radiology is still one of the most highly compensated fields of medicine. There are other studies that still show radiology in the top 3 or 4 professions. So how many of you radiologists in the room, even the residents and fellows, have a nice car and a nice home, take some time to travel, enjoy a nice restaurant, a glass of wine? Things are still pretty good for radiology. And remember, radiology is a profession. It's a business secondarily. I think most radiologists recognize that we didn't go in this to become rich. We went into radiology to help, to do science, and to enjoy helping others. And I think this is secondary. But here's something that you all should recognize. In 1995, the average salary for a radiologist was roughly equal to that of surgeons and anesthesiologists. In 2011, radiologists' income was 30% higher. Now, what's likely to happen in the future? I think radiologists have been very lucky. We continue to enjoy a great specialty. Radiologists are still compensated handsomely, as I just showed you. ACR surveys, in fact, suggest that the number of jobs offered in the next 1 or 2 years will equal or surpass the number of those in training. Our training programs are still filled with the best and the brightest. Research and innovation continues. It is more difficult, but there are new areas of science and in radiology that we move forward, particularly in the area of genomics. So what do I expect and what do most of us suspect? Reimbursement will probably go lower. The government and third-party payers do intend to shift dollars from specialists to primary care physicians. The number of imaging studies, in my opinion, will probably increase as the population ages and as more people are covered by insurance. Inappropriate utilization, what we have talked about as self-referral, will probably decrease and perhaps end. There's more conversation. It was even in the president's budget this year. He suggested that we close the in-office ancillary exemption. Utilization management, we believe, will play a greater role, and you'll be hearing more about decision support. We believe that volume will give way to value and that output will be replaced by outcomes. To some extent, I think we have ourselves to blame. We have been somewhat a victim of our own success, and we have had a sense of entitlement. We have over 36,000 members, but only about 70% of all radiologists, radiation oncologists, and medical physicists belong to the college. In some cases, in some sense, it's unfortunate that those 30% of radiologists and ROs and medical physicists who don't belong receive many of the benefits of our members. Only 12% of our membership donates to RADPAC. RADPAC is our voice on the Congress, to the Congress. We try each year to raise that. Our target is 20%. Now people need to give more, not less. I hear from people through emails and phone calls that because of their economic circumstances, because they're giving to the RLI or some other charity, they're going to cut back on RADPAC. That's exactly the wrong thing to do at this time in the circumstances that radiology faces. We have a call for action. You've heard about the Radiology Advocacy Network. We've had our best efforts ever, but even that is very low. Only 7,000 members out of 36,000 contacted their Congress about the initiatives that we had last year about the MPPR. Our visit to Capitol Hill each year takes 300 or 400 people. We need more people, like I showed you in that slide, with thousands attending our visit to the Hill. And our face of radiology has also had limited success. We need all radiologists to get out from behind the workstation and go out and meet the patients, talk to them, touch them, bind with them, and be their consultant. The ACR, including the Board of Chancellors and our staff and the steering committee, we're not deaf and we're not blind. We are aware that some members and non-members are anxious about what the future will hold. We're aware that there's a significant number of people who feel that our dues are too high. We feel that our dues are well spent. We're aware of some friction between academic and private practice. We are working hard to try to dispel that friction. I would urge you, if you are not already, to, on a regular basis, read the JACR, look at our bulletin, and read what's in our advocacy update. A few quick things to let you know that we have in progress an attempt to build a guideline for the use of CT in the screening for lung cancer. The Commission on Breast Imaging is continuing to monitor dense breast legislation and reimbursement. The ACR continues to push for reimbursement for CT colonography, and we continue to respond to reorganization of the National Institute of Health grants for research. We know that there is some membership disconnect, that there are people in our members who ask, why doesn't the ACR stop all cuts in reimbursement? We wish it was simple. It is not. Many in academics are finding, particularly the residents, that it's difficult to find jobs. As I told you, our surveys show that there are jobs out there. There is decreased reimbursement, and many people are going to increase productivity. We are faced by, in some cases, predatory activities by national teleradiology providers. You will hear later this week a report from our teleradiology task force. So during this meeting, we will try to encourage open and free discussion. The speaker and vice speaker have provided for a significant amount of open mic discussion. We will have a large block of time devoted to economics and advocacy. You will hear a great deal more about Imaging 3.0. And as I said, we will have the open mics. We welcome your comments and your suggestions. Ladies and gentlemen, once again, welcome to the annual meeting and Chapter Leadership Conference.